is Alice and I will be the one interviewing you today. Are you ready? Of course, good afternoon, Miss. Let's start with the most basic questions. Could you tell me a little bit about yourself? I'm Vivi, 24 years old. I've just graduated from nursing major at University of Indonesia this year. But previously, I have been working at a local hospital for 2.5 years as a nurse and enjoying it. I have been working at emergency unit and NICU, and I'm also deaf in handling patients, especially patients who have experienced trauma or critical condition. What do you know about military hospital in various locations in Saudi Arabia? There are about 415 governmental hospitals and 127 private hospitals in Saudi Arabia. 270 of them are under Ministry of Health. There are also several military hospitals spread throughout the Saudi Arabia region. There are Northwest Armed Force Hospital in Tabuk, Prince Sultan Military Medical City in Riyadh, King Fahd Armed Force Hospital in Jeddah, King Fahd Military Medical Complex in Bahrain, Qasim Armed Force Hospital in Buraida, and Al Hada and Taif Military Hospital in Taif. Military hospitals in Saudi Arabia have sophisticated and modern equipment, facilities, and have been rewarded several times for their research and treatment. So do you love being a nurse, and why did you decide to become a nurse? Yes, I do. I love being a nurse, but previously I didn't think of becoming a nurse. However, since childhood, I always loved to help people, even animals who are in pain or in accident. And I decided to become a nurse rather than a doctor because nurse education is farther than doctor education. And I think a nurse is the closest person to patients. Nurse are always there when patient needs, whereas doctors aren't always standby. That's why I prefer being a nurse. Tell me what you feel your greatest skill as a nurse is. I'm very proud of my ability to help trauma patients like an accident victim because I have attended BTCLS training and I have worked in an emergency unit. I have dealt with patients who have had fires in almost their entire bodies, and I have treated these patients without hesitation and have saved their life. Then, I also have the ability to massage babies because I have attended massage babies training too. I've often done baby massage and also use my ability to massage the babies to get extra income. How do you handle the stress of the job? I have 4 personal ways to handle the stress of my job. The first is not delaying any work. If there is a patient who has just arrived, I immediately take anamnesia and not delay it, so that nursing care can be made immediately. The second is using break effectively. If it is time to break, I will use that time to relax my body. Because if my body is exhausted, then I will get sick and cannot work optimally. The next way is consulting any problem with CI, as if I am confused in determining the nursing diagnosis. Then I will consult with my CI. The last is motivate myself. Like I'm tired of the work I'm facing, I will motivate myself to stay focused and passionate because I have to be responsible for my work. What do you find is the hardest part about being a nurse? I think the hardest thing I've had to deal with is feeling helpless. For example, when there are patients who are critical or in need of surgery, but their family is experiencing financial constraint, so the hospital cannot continue the treatment. That's where I, as a nurse, feel helpless and cannot do anything. What do you want to work here? I want to try next experience by working in Saudi Arabian military hospitals, which is famous for its technological capabilities in treating patients, and I want to have the experience of what it's like to work in a military hospital. And I heard that military hospitals in Saudi Arabia deal more with trauma patients, and I have expertise in that field, as I said before. Are you comfortable working with other doctor and nurse? I can work well with other doctor and nurse. Not only them, I also have a good relationship with pharmacists and nutritionists to discuss the intervention for the patients. Describe a time you had to deal with a difficult patient and how you handled that. Previously, I've often faced patients who were angry and always asked for precedence. even though the condition at the time was not life-threatening. And on the other hand, there were patients who were in critical times, so we had to put this patient first. But the angry patient remained stubborn despite the circumstance. It was enough to make me dizzy. Okay, last question. Why should we hire you? I believe that I could contribute a lot to your hospital and that all of my energy and care will totally be focused on helping and taking care of my patient. Then in the job vacancy needed sub-nurse in an ICU, and I previously had experience working in an ICU room for 1.5 years, and I am ready to receive a lot of experience in this hospital. Do you have any question for us? Do you have an orientation program? What is it like and how does it run? Yes, we have orientation program around 1 week to 1 month depending on placement. Understood. Thank you so much for having me. I'm really looking forward to this interview result.